Good afternoon, good day, everyone. My name is Dr. Manish Kohli. I'm a senior advisor at the Albright Stonebridge Group and the past chairman of Board of HIMSS. I am truly honored and delighted to join this webinar today and welcome you from wherever you might be watching or listening live. Let's look at where we stand today. In today's day and age, more people have access to a mobile phone than they have to clean water, electricity, or toothbrushes. In fact, if you look at the penetration of mobile phone subscriptions between 2000 and 2017, the numbers have improved significantly. Even countries on the left end of the spectrum, for example, Burundi, have gone from virtually no mobile subscription penetration to over 50% of the population with access to a mobile subscription. Countries like the United Arab Emirates currently have 2 mobile phone subscriptions per resident in the country. We also look at the power of having technology in the hands of the individual. Registered mobile money accounts between 2011 and 2018 have proliferated where almost a billion people, close to 900 million across the world, have access to a registered mobile money account. And almost 80% are in Africa and South Asia. We also see that devices are getting smaller, more powerful and pervasive, and they're generating more and more data. Not only big boxes like ultrasound, CT scans, and so forth, but also small boxes are proliferating, not only in the hospitals, but also outside the hospitals. And they're generating lots and lots of data. But despite the power of technology that is in front of us and that we've been able to leverage during the pandemic, we still recognize that we spend too much on healthcare globally, to the tune of almost $8 trillion annually. And despite spending this much money, 3 billion people around the world are without access to a healthcare professional. As we have learned in COVID, our health system and public health system did not do so terribly well. And there are opportunities for improvement. And the question is COVID-19 a tipping point for telehealth? We certainly have data to see that because of relaxation of regulations and the willingness of payers to pay for telehealth, the adoption has been quite significant. And when we look at the use cases, there's 7 principal types of telehealth use cases as articulated by the AHA. They could be provider-to-provider platforms or direct-to-consumer platforms. They could be synchronous or asynchronous and with or without video. And when you start looking at use cases and specific objectives that they tend to serve, you realize that we actually have a toolkit, toolkit that is now able to allow us to solve some of the problems healthcare and health systems have struggled with for a very long time. Things like improving access to specialists and capacity, improving space efficiency and managing capacity, improving the patient and the family experience, strengthening care coordination and referrals, enabling growth, enhancing clinical relationship with partners and specialty network, and also for implementing an expansion of more value-based payment model, hopefully in the goal of reducing cost of care. Our health systems, in some cases, were able to pivot quite rapidly. And one of the classic success stories during the pandemic has been the NetSyn project, which allowed critical care physicians to be able to service remote communities throughout the United States through the power of a mobile connection. Another ray of light that has come out of telehealth, and this is an organization that I'm personally involved with. Wings of Hope is an aviation-based nonprofit organization that serves to help marginalized populations across the world who have no access, little or no access to healthcare and services. Wings of Hope has partnered with the Colombian Civil Air Patrol in hopes of providing round-the-year access to healthcare services to the population that lie in the most remote regions of Colombia. We've been looking at leveraging telehealth and remote patient monitoring to provide access to services to these communities beyond the time when the planes are actually physically on the ground. We're also looking at additional technologies to really begin to look at solving supply chain issues, for example, using drones and data analytics and so forth. So when we look at emerging from the post-pandemic world, it's clear that telehealth alone is not going to be the panacea. We're going to need to think differently about solving complex problems and coming together as a healthcare fraternity, CEs, doctors, nurses, and administrators and technologists to solve complex problems. We need to think about technology architecture differently. We need to invest in dynamic, sustainable architecture. We need to think about bringing data and intelligence to scale to begin modeling some of the complex care processes in healthcare through digital twinning. This eliminates the risk and allows healthcare to be more nimble in terms of adoption of technology and novel solutions. We need to empower everybody from the C-suite to the frontline physicians and nurses and CEs to solve complex problems. We need to help democratize access to tech to augment the skills gap. Virtualization obviously is going to not only help with telehealth, but also with remote work capabilities, and also monitoring patients in situations where physical monitoring is not possible. Combining that with robotic process automation is going to create a compelling toolkit for us to begin to solve complex problems. And ultimately, it does boil down to sharing and collaboration within disciplines, across disciplines, and across the entire ecosystem. With 805,000 clinical engineers globally, I see an opportunity right in front of us where we can collaborate together to penetrate even the most marginalized communities and really serve our patients in a manner that we deliver to them healthcare that is safe, effective, accessible, and at low cost. It's imperative that we all come together to leave healthcare better than we found it. Thank you.